We're going to continue to talk about the issue of booster shots. This booster program is going to start here September the 20th, pending approval of the FDA and the CDC committee. The question raised is, should it be shorter than 8 months? Or should it be as little as 5 months? And that's being discussed.
President Biden floating quicker access to booster shots as the Delta variant surge continues across the nation. Almost every county now reporting high community transmission. For more, let's bring in the president's chief medical advisor, Dr. Anthony Fauci. Good morning to you, Dr. Fauci. The latest data is really startling. The daily new case average up 153% in the last month. COVID hospitalizations surpassed 100,000 for the first time since January, and daily COVID-related deaths steadily increasing, besides increasing vaccination. So what needs to happen at a time when COVID fatigue seems off the charts?
Well, we can't let COVID fatigue overcome us, Martha. We still are in a situation where there's a lot that we can do about it. We have now about 80 million people in this country who are eligible to be vaccinated who have not yet gotten vaccinated. We need to get those people vaccination. We have a highly effective and safe tool to really get down those numbers that you just accurately portrayed. Those are numbers that are really quite startling. We are still in an upsurge. The numbers that you gave are very, very alarming, but we can do something about it. If it was a situation in which we had no recourse or no tools, you could see how frustrating would it be. But it's even more frustrating when you have the situation where we do have a vaccine that's highly effective, highly safe, accessible, free, and it works. We've really got to get those people who are not vaccinated in that group vaccinated.
I really want to concentrate on school kids with you this morning. As we transition into the fall, of course, we have all these kids going to school, and pediatric hospital admissions are at the highest point of the pandemic. Does the Delta variant just hit them harder than we expected? What's happening?
Well, what we're seeing is that this variant, Martha, is highly transmissible. The ability to transmit from person to person is much, much greater and more efficient than the prior variants, the Alpha variant that we had. That's affecting both adults and children. So you're going to see more children infected, and quantitatively, since more children are infected, you're going to see more children, unfortunately, getting hospitalized. And that's what we're seeing. We're seeing that we've got to cut down the community spread. You can protect children who can't get vaccinated because of their age, yet we can protect them by surrounding them with a community of people who are vaccinated. That's how you protect children. And you also do it by complying with the CDC guidelines about masking, particularly masking in school. Even though you have vaccinated teachers and vaccinated personnel, you want to give that extra added level of protection for the children. That's the way we can protect them.
And what's the latest timetable for getting vaccine shots for children under 12?
Well, right now the data has been collected, and we should have enough data by, I would say, the end of September, middle to end of September, early October, so that those data can then be presented to the FDA to examine for the risk-benefit ratio of safety and effectiveness. So at least they're going to be able to look at the data as we get into the middle and end of September. Hopefully we'll be acting quickly, depending on the data and their assessment of the risk-benefit ratio.
And Dr. Fauci, President Biden, you heard him say there that they're looking at whether booster shots should be given sooner than 8 months, perhaps as early as 5 months. What's your recommendation?
Well, we're still sticking with the 8 months, Martha. However, as we've said, even in the original statement that came out, we're going to have to go through the standard way of the FDA looking at the data and then the Advisory Committee on Immunization Practices. So although we're sticking with 8, we're remaining flexible that if the data tells us differently, we'll make adjustments accordingly. But for now, we're sticking with the 8.
And finally, Dr. Fauci, the intelligence community delivered that review on the origins of coronavirus. It was inconclusive. Will we ever know?
You know, I hope so, Martha, because it will help us to avoid this in the future. But we will need the cooperation of Chinese scientists and Chinese public health officials if we're going to do the proper surveillance serologically of people who were infected in China, as well as the animals, being able to assess whether or not animals have viruses that are closely related to SARS-CoV-2. We'll need to do that in China with the cooperation of the Chinese.
Well, we'll hope we get that done. Thanks so much for joining us this morning, Dr. Fauci.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.